Welcome to Natural Habitat Adventures Daily Dose of Nature, enhancing safety with Nat Hab during COVID-19. We have a really great panel for you today. And first, I'd like to introduce you to Nat Hab's Field Operations Manager, Corbin Hawkins. It's so wonderful to have you all with us today. Corbin, I'm going to hand it off to you.
Hey, thanks, Kendall. We're getting to do this more and more often, it seems. So always a pleasure working with you and good to hear from you again. And you're right, we do have a great lineup today. I would say it's actually a rock star lineup because we've got Renata Haas, our Director of Field Staff, and Ben Bressler, the Explorer, Founder, and President of Natural Habitat Adventures. So first, a little bit about myself. My name is Corbin Hawkins, and as Kendra said, I'm the Field Operations Manager. Basically what that means is if we're running trips somewhere in the world and we have staff on the ground, I've got my hands in the mix somehow or another. And then Renata, I'll hand it over to you for just a quick blurb about yourself, and then we'll move into what Ben has to say and share with us today.
Thanks, Corbin. So my name again is Renata. I am the Director of Field Staff at Natural Habitat Adventures. I've been working with Nat Hab for about 8 years and really focus on our guides and field staff and logistics, getting trips off the ground and running. And then for the past year, I've also been leading our COVID task force and creating those protocols that we have been using to run our trips during this time.
Awesome, thanks Renata. And we will touch back on what all that COVID protocol and all that task force has to do with how we're currently operating. But Ben, I know you're a little short on time, so if you wanted to take a moment and introduce yourself and tell us kind of what you've been involved with in this whole pandemic that we're all experiencing right now.
Sure, thank you, Corbin and Renata, and thank you all for joining. You know, being on with these folks here, I put my guide on partially because you know, I wanted to be a guide like these two, get out in the field. And the other part, of course, is because we're all quarantined. I haven't showered in 2 weeks, which isn't quite true, but it's somewhat close. So I wanted to, you know, thank you all for coming. I wish I was dialing in from someplace cool. I'm in a hotel room in Los Angeles, but that's the way that goes. They're going to talk to you today about our COVID protocols, but I just want to introduce a little bit about you know, the industry for a second and what we've been going through. You know, there's no denying that it's been a very tough year for the travel industry. I mean, that's so apparent. Everybody sees it. Many companies in the U.S. have gone out of business. Some or many of them are hurting. You know, we felt COVID personally at Nat Hab. We've had to, you know, contract ourselves a little bit. We've had COVID within the Nat Hab family and even COVID deaths with family members from Nat Hab employees, which of course has been so incredibly impactful on us. As a business, we'll be fine because we have saved our profits for years and we've been very conservative as a company. So in that regard, we're fine. But I wanted to talk to you today a little bit about the local people in the areas we travel to. That's where our concern is. These are the most vulnerable people. What they are is the frontline workers in conservation travel. They are camp workers, they're waiters, they're waitresses, they're hotel workers, they're drivers, they're park rangers. These are the people who live conservation travel and who work in the industry so that they can feed their families, of course, and also protect the wildlife and wild places that we have come to love. And they've been left out on this. In America, we generally are going to be okay. We're going to be able to eat. You know, even the companies that went out of business, even the people that lost their jobs, we're probably going to be okay. But these people are often, well, they had revenue and all of a sudden that revenue dried up. You know, they often are responsible not only for themselves, but their families, and that's often large families. They could be extended families of 20 people or even maybe entire villages. When COVID came about, of course, our first reaction was to think about our company, but we pretty quickly realized, wow, there's a lot of people depending on us bringing travelers to see them, and they're not coming. So we created a community relief fund, Nat Hab's Community Relief Fund. We seeded that fund with $25,000, and we said to our guests, hey, would you like to contribute to this? And I thought maybe we could raise another 25 or 50 or at most $100,000. Well, within a month, we raised $350,000, and it was unbelievable. To me, it was the most meaningful thing that we've been able to accomplish as a company, even in all of this, in COVID and pandemic, and the hurt that has been felt throughout the U.S. We all felt like, wow, there's some hope. Our guests are so committed, and today I want to thank you. Yes, I'd love to continue to raise money for that, but today I really just wanted to come to you and thank you all for the contributions you've made for these people. The emails and letters we've gotten from these local folks who have made it through because of us have been so heartening. And not just Nat Hab, it is the entire family, which includes, of course, our travelers. So I wanted to say that to you all. I want to hand you back over to Corbin and Renata, who can talk about the technical elements of reemerging or emerging from COVID. So it's an exciting time that we're even talking about this, and I wish you the best, and thank you so much.
Thanks, Ben. It was great hearing from you, and we'll look to talk to you soon, real soon, sounds like.
Peace, people.
Thanks, Ben.
All right, so Renata, switching gears here a little bit, kind of getting into the nuts and bolts of how this is all going to work moving forward. But first, I think it's important to answer one big question: is why? What is all of this for, and what are we here for?
Thanks, Corbin. Yeah, so it's always important to start with the why. So why are we having this webinar right now? And we at Nat Hab think it's important to tell our guests and those who are interested in being guests with Nat Hab more about the process that's involved with going on a trip right now. So how are these protocols developed? What does it look like in the field? And what are we expecting in the future? So we wanted to give more of that background. And we also wanted to take some time to show you what's been going on over the past year, what it looks like for us when COVID started through where we are today, and then again what we're looking forward to in the next 6 months to a year.
So let's start from the beginning. Yeah, I think we were both actually traveling in March of last year, almost a year to the date, and the world came to an end, right?
Yeah, we shut down pretty instantly. And we were running trips. We had guests, I don't know if everyone remembers when we went into that initial quarantine, but we had trips running in Canada, in Africa, India, Argentina, all over the world. And when we realized that areas were going to start to shut down incredibly rapidly, we needed to, as an operations team within our flight department, really a huge majority of our company switched focus completely to getting those individuals who were out in the field back home safely. And I can't thank everyone that worked on that process enough, and our guests for their flexibility to get home when we needed to get home to start that initial quarantine. I was actually on a flight home from Spain when our last Northern Lights trip was about to start. When I took off, the welcome dinner was just about to begin. And by the time I landed, I'd been on calls the whole entire red-eye flight, and we had determined that it wasn't going to be possible to run the trip. We had worked with guests to rebook their flights and got them out and ready to head home the next morning. So it is incredible the amount of work that went into bringing people back home and getting ready for what then was, just as we see in this photo, a complete halt globally.
Yeah, for those of you interested, these photos all came from a CNN article in which they were just trying to depict the emptiness that we all experienced right there at the beginning throughout our world. So where does that bring us now, Renata? What's our main priority moving forward?
Yeah, so we essentially we went into that global quarantine, and Nat Hab had to determine pretty quickly what our priorities were going to be. First and foremost, honestly, was the community relief fund that Ben spoke about a little bit earlier, was determining how we were going to help those individuals that are on the front lines of conserving the places that we love, but are not able to do so because we haven't been able to run trips. So that was an incredible effort from all areas of the company, individuals that we work with in the field, and at the end of the day, our travelers as well. So it was amazing to see that effort from everyone. And then the effort went into how are we going to run trips again? How are we going to create protocol to be able to mitigate risk on trip, and what does it look like to travel in a COVID area? So with that, we put together within our operations team a COVID task force that would be charged with creating these protocols.
Yeah, and from my understanding, having kind of poured through this document and with all the what if this and what if that, and trying to answer all these questions, this was a lengthy process. This was no easy feat for you guys. So how did you arrive at this this 20-page or so document that we have that's our COVID protocol?
So this was a pretty substantial process and included a lot of different steps. So first and foremost, we needed to determine what our priorities in creating these protocols were, and with the overarching goal of reducing risk as much as possible for our guests, our field staff, the communities that we visit, from getting or transmitting COVID during the course of a trip. So our COVID task force developed these set of priorities, and first and foremost, to create the skeleton of the protocols, we had to do a lot of research. So we researched recommendations from the CDC and World Health Organization to create that skeleton. After the research and the skeleton was created, it was then incredibly important for us to collaborate with other leaders in the adventure travel and outdoor industry. So we had a lot of meetings to discuss what other companies were looking at, what other industry leaders were doing for every component of the trip. And this is a sharing of best practices, which was so important to make sure that we were really crossing every T and dotting every I for each component of our protocols. Once we took the time to collaborate, create these protocols, we then had to look to all of our trips. And when we run a trip, it's not just the guide and the guests going by themselves into nature. We work with partners all over the world. These partners are the hotel operators, transportation, the individuals that run transportation, restaurant owners, activity partners. So we had to develop a way to vet their protocols, to make sure that the individuals that we were working with were meeting the standards that we thought were acceptable to run trips. So we created a vetting process that allows for us to, with everyone that we are working with, make sure that they are abiding by protocols that we do feel reduce that risk for everyone that is on our programs. After we determined how we were going to screen all of our partners, the next step, work with all of our partners, the next step was to develop a screening process. So what a screening process is sort of taking those steps to, as much as possible, screen that a guest or a partner does not have COVID or coming on the trip with COVID. So we just developed a screening process for our guests and expedition leaders and operations staff in the field, which is daily symptom and temperature checks. And along with that, we also worked with United Healthcare Global to develop protocols where if a guest is showing symptoms of COVID, We have a team of doctors that can conduct a virtual health assessment to evaluate symptoms and provide next steps. So that was incredibly important for us as well. After going into screening, we needed to determine how we were going to train all of our staff in the field on these protocols. So we created a training process. So before a trip or season is going to run, where I actually work with every guide and field staff to go through that training and our protocols to make sure they understand exactly what we are looking for when it comes to implementing these protocols, and to ensure they don't have any questions and are ready for those trips to begin. And then after training comes expectations. So we need to really make sure that expectations are set for our guests and for our staff in the field of what trips are going to be like. During COVID, we have all had to participate in mitigating our own risks. We've all had to wear masks, wash our hands, physically distance. So it was really important that we set expectations with guests on that, especially at the start of the trip. Start of when we started running trips back in July last year, because there were a lot of individuals out there who didn't think that, for example, wearing masks in closed, tight spaces were necessary. So we really had to set those expectations. And along with that, we also wanted to make sure that when one of our guests leave their house and got ready to go on their trip, that they were fully ready to participate in reducing that risk. So what that meant is we sent them KN95 masks, hand sanitizer, sanitizing wipes, and information on sort of the best way to travel and precautions to take, so that as soon as you step out of your house and get ready to go on your adventure, you know what steps you can take to help mitigate that risk.
Absolutely. And just to step back a little bit, Renata, I just wanted to say that I'm so happy to work for a company and a team that's so thorough with all of this. Per this document that you guys have created, especially in regards to the partnerships that we work with anywhere, it's really, really in depth. I myself, having been working in Yellowstone last summer, have walked into hotels and into kitchens and restaurants, and to make sure that people have their gloves on, they have their masks on, to make sure that these enhanced safety measures are being met. So it's not just on paper, it's really happening in the field, and we're really working very hard to make sure that all of these partners that we work with are taking this as seriously as we are. So thank you for that. But you did mention a little bit about expectations and preparing people to come on the trips. And I think what that boils down to is the combination intervention approach, of which you have headed the development of. So what are we doing in the field? What is that multi-step process that we are abiding by to allow us to travel safely?
So when looking and creating these protocols, our focus is, as you just said, combination intervention approach. And what that means is that the optimal way to mitigate the spread of COVID-19 virus transmission is through a combination of interventions. These each control can provide an additional degree of protection, even if one intervention fails or is not available. So the first part of a combination intervention approach is something we are all incredibly familiar with at this point. And we probably have a few of them, surrounds respiratory hygiene. So that means wearing a face mask. And it means if you have to cough and you're not wearing a face mask because you're outside in nature, you're using your elbow instead of your hand, or making sure that you're blowing your nose. But with respiratory hygiene and wearing a mask, our protocols dictate that if you are inside or not able to socially or physically distance outside, you need to wear a face covering. And it is the case that we're seeing that various areas of the world and in the US as well have different regulations. So sometimes it is the case that Mexico, for example, when we started our monarchs program, if you were outside, regardless of if you were physically distanced or not, you had to wear a face covering. So that is the first component of this combination intervention approach, is respiratory hygiene.
And just to reiterate, Renata, at all times in our vehicles, we are mandating the use of masks.
Absolutely, yes. When we are inside and in our vehicles, of course. So next is hand hygiene. I think this was before masks were as well known as they were to really mitigate that transmission of COVID. Hand washing was first and foremost. I think there was a TikTok of a few different dances of people showing how to wash their hands. So we promote hand washing frequently throughout the trip, and the guides and field staff give ample opportunity for this. Again, we also provide individuals with individual hand sanitizer that has at least 60% alcohol, and it is also readily available on the trip in case maybe you left it in the vehicle or don't have access to it. So we really make sure that hand hygiene is readily available for everyone.
I thoroughly enjoyed relearning how to wash my hands in my late 20s, for sure.
So then we get into physical distancing. So physical distancing is maintaining at least 6 feet of space between people that are not in your family group. So wherever we can do this and implement this in our protocol, physical distancing is incredibly important. The wonderful thing about Nat Hab is that we run small group tours. So it's not like we're trying to physical distance 30 different people in a large bus tour. If we have 8, 10, 12 individuals on a trip, it is quite easy to do that in the settings that we go to on our journeys. And then finally, the last intervention and control that we use is enhanced sanitation. So this includes cleaning and disinfecting high-touch surfaces to mitigate the spread of COVID through droplets that are left on surfaces. So in everything that we do, we look at how we can clean those high-touch surfaces and then what areas we need to.
So Renata, what does all of this look like on a trip? I'm trying to imagine moving forward. I'm fortunate enough to be able to run some of our trips in Yellowstone, but internationally and on the rest of our trips, what does this look like in the field? And I guess we can start with the vehicles. As you just mentioned, we have small groups, and so it's not quite so hard for us to move about in our vehicles, but what is that going to look like?
So again, the small group is key. So we make sure just in general on our trips, even before COVID, is that everyone was able to have a window seat, and we really never fill our vehicles to capacity. And that's the same with COVID. So we reduced the capacity in a lot of our vehicles to allow for individuals to spread out, as you can see here with our Nat Hab safari trucks. Not only are we only putting 7 individuals in these vehicles, they also have those hatches which allow for us to be in that fresh air viewing wildlife. This is one of our safari vehicles that was being utilized during one of our Kenya trips. So you can see that we really want to increase ventilation as much as possible. And so being on a trip during COVID and pre-COVID look pretty similar because of how Nat Hab has designed our small group tours. And here's just another photo of those really open air vehicles. Same thing with boats as well, is that we're going to reduce the number of individuals on those boats. And if we can't physical distance while we are on them, guests will, and all staff will be wearing face coverings. Another way that we travel on a lot of our trips is by various types of aircraft. So this is a float plane in Alaska, and we again ensure that we're vetting our partners that are operating those float planes. Guests are wearing face coverings on them so that they can still enjoy the journey and be able to go on that trip even though they're taking a flight on it.
And I know a lot of folks have questions about meals, and it is an area of concern, of course, because this is a time where you are biologically required to take your masks off in order to eat. So what have we been doing in terms of creating more space around mealtime?
So this is one of the areas that it actually allowed us to really enhance the guest experience. Normally when we do lunches, we used to concentrate a pretty good amount on doing setting up meals in the field, but we still had a lot of restaurant experiences on our trips. So we've really expanded and upped our game in the field meal component. So what was really key with our meals and eating during COVID is that there's flexibility. When we look at a trip and how a trip is going to run, we have sort of a few sets of standards. So first and foremost, we want to be able to get guests eating outside, physically distanced. That is our main priority. If that is not the case, we then look at indoor dining spaces where we can spread out and that are private. So specifically rooms that are specifically to Nat Hab. If they have ventilation, we'll make sure that there is ventilated spaces. And then after that is if we're eating in a restaurant and we don't have the ability to have a private space, making sure that that restaurant is operating at a limited capacity. Now, that being said, this is where flexibility comes in as key. We have had trips where we've vetted our partners, and the first trip they ate in the restaurant and they were below capacity and abiding by all those guidelines. Great experience for our guests. And then the next trip, the guide got there with the group and realized that they were not comfortable with that dining situation. So the guide will either pick another hotel or we'll get takeout for guests to enjoy their meal in their room. So we have a lot of different levels for how we do our meals, and just asking that flexibility so we can still have an amazing trip and enjoy the meals that are prepared for us.
Yeah, it really is. I mean, as far as silver linings are concerned, I would say that this has been the biggest one, is being able to spend more time outdoors, and it actually provides us a few other opportunities as well. One of the big things we like to do on these trips is invite some, outside presenters in, and with our situation as it is, we're already outside, and so we can actually participate in some of these activities furthermore. So Renata, tell us a little bit about what's going on here, and furthermore, what else are we going to be doing on these trips during the time of COVID, and how does that look?
So again, everything is looked at from the lens of the combination intervention approach. So again, outside is key. This is Aaron Bott, who is a presenter within our Yellowstone ecosystem, speaking with the group. And you can see these two individuals here within the same travel party, and you can see at least 6 feet away, there's a little leg of the next couple. So we really want to make sure people are spread out. And we're natural habitat adventurers. Our whole point is to be in nature and to experience nature. So to be able to take Aaron and his talk outside where it should be, where in the area where he's actually doing that work, has been really wonderful, and it allows us to connect so much deeper to that sense of place. Other activities is photography, where again, incredibly easy to social distance in such small groups outside. This is on our monarch butterfly strips. I'm not sure if you can see the little monarch that is on this gentleman's head, but photography looks pretty similar pre-COVID and during COVID because of how we organize our trips. And with hiking is obviously a huge component of any Nat Hab trip. It's making sure that we have more, that we have multiple expedition leaders. We have an additional operations staff individual on the trip to help space those groups out. If we have slower individuals or faster individuals that want to get more, we are able to break that group up and really keep people spaced out so they can enjoy the area that we're traveling to.
This is such a gorgeous photo. I can't wait to get out there.
And the same for kayaking is on quite a few components of our trip is if we're doing double kayaks, keeping those traveling parties together. And it's just, again, so easy. This doesn't look much different than it would if we were traveling pre-COVID. So with our equipment that we're utilizing, if it's communal equipment, we're making sure that it is sanitized before and after use, which is incredibly important. And also that you're getting the instructions on how to utilize that kayak paddle, how to make those turns. And here is another fantastic photo, people spread out in the boat, taking that time to view wildlife. So again, incredibly similar to how we would be doing things pre-COVID. And we do make sure that if it is the case that we need to get an additional vehicle, or if we need to get an additional boat, whatever it might be, if we need more of that to keep everything comfortable for the group, that is absolutely something that we are willing and make sure that we do to keep in line with our protocols and to keep the guests, everyone enjoying the experience on the trip and mitigating that risk as much as possible.
I love the fact that when we were developing this presentation for today, that it really wasn't hard for us to find photos that could very easily be taking place during the pandemic. To your point, this is a pre-pandemic trip, and these folks are separated. Everyone's got their own space. The only additional thing that I think we would see in a post-pandemic travel photo would be the masks, of course. But not much has changed for us as far as the wildlife viewing goes.
Absolutely, and that is what we're all on these journeys for. This photo was actually taken on a Yellowstone trip, and this is, I believe, the Lamar Valley, and you can see that we have scopes set up. The scopes are set up and spread out. We're taking more time to actually teach our guests how to utilize that equipment, but again, making sure that we're sanitizing it in between use, making sure we're sanitizing lenses, and then also creating space if guests need a snack or something while we are taking that time to view wildlife, that they have access to that in a larger open space to ensure that we can keep people physically distanced. And this is in the Galapagos, and in the Galapagos, wildlife is just all literally all over the place. So we, again, just make sure we're keeping people spread out, not just from other people, but also from the wildlife as well.
It's so fun going through these, and I feel like we're kind of harping on the same point here, but this is just what we do, and it's wonderful that we're able to get back into it, or starting to get back into it. And going to check out some of these animals. Now, Renata, I think one of the big things we wanted to come away with from this webinar was to just tackle some of the big what ifs and the big questions head on. So I think you've got those there, and let's see if we can answer them for people before we get asked.
Absolutely. So there's, as Corbin said, there are sort of the same questions that keep coming up, which is incredibly understandable, and they've changed slightly since the pandemic started. I think at the start of the pandemic, the questions surrounding am I going to need to wear a mask has sort of changed to, what does testing look like? What does COVID testing look like at Nat Hab? Is that required? I need to get it to go back to the US. What does that look like? So for testing at Nat Hab starting in May, for trips that are starting in May moving forward, we will be requiring guests to get tested prior to their departure date, so getting tested at home, which now is a lot easier than it used to be. We didn't mandate it when we started running trips, because trying to be getting a test, I don't know if anyone had to get tested earlier in COVID, but it was incredibly difficult, and results could take from 3 days all the way up to 10 days. And I think I've known a few people that it's taken them as much as 2 weeks. So now we're at a place in this pandemic where CVS, Walgreens have drive-through pharmacies in most cities in America. And there are also a lot of different companies. LabCorp, for example, has a test called Pixel that you can order, get it delivered at home. You can self-administer a COVID test, pop it in the mail, and get results a day or two later. So it is much easier to get tests. So that is why we are requiring those starting in May. There are areas where it is necessary to get a test to come back to the US. And if that is the case, that is something that Nat Hab will facilitate for those groups and those guests to make that that process as seamless as possible. Getting a test doesn't take a lot of time. It's quite easy. So it is very, very important to us that it is a quick and simple thing to do. The next big question that comes up is, are we going to require guests to get a vaccine and to be vaccinated on trip? So this is something that we revisit on a weekly basis, and this is because right now it's not the vaccine isn't available to every single individual in the US. So at this point we're not requiring it, but that very well could change as more and more people are able to get vaccinated and it becomes widely distributed across the US. And the next big question that we get from guests is, when are you going to tell me if my trip is going to be canceled? I'm signed up, I'm ready to go. My trip isn't until the summer, it's not until the fall, but I have concerns. And I just want to know when you're going to tell me if we're going to run this trip or not. So from our side in the office, we take an incredible amount of time looking at each departure, what's going on in that country, if we can get into the country, what the COVID cases are like there, what vaccine distribution looks like there, what the medical facilities are like. So with everything that's changing as rapidly as it's changing, we do an initial assessment at 90 days prior to the start of the trip. And then our goal is to communicate to any guests that are on that trip by 60 days and give them a understanding of whether we are going to be able to run that trip, or if we need to work with those guests to facilitate moving their trip to either a later departure or a different departure, depending on where they would like to travel. And then the last question that we tend to get quite a bit is, what happens if I have to quarantine? So again, we have this combination intervention approach, and we do everything possible for prevention. In the unlikely event that you would need to quarantine on trip, we will ensure that we have someone in our office that is able to work with you, and then also someone on the ground that can help facilitate that process. It is important to note, though, that if you do have to quarantine during a trip, if you get our comprehensive insurance, there are funds available to help cover that cost if you do have to quarantine. I will say, though, over the course of the trips that we've been running in their national parks, Mexico, Africa, Costa Rica, we have not had a single case of transmission of COVID. We haven't had a single quarantine. So we are really taking these protocols incredibly seriously, and so happy to be able to continue moving forward with operating of trips around the world.
Awesome. Thanks, Renata, for kind of crushing through those for us. But moving forward, like you said, let's put a time frame on it. What are you expecting to see in the next 6 months or so?
Good news. First and foremost, it has been so wonderful to just see the positive news that is coming out each and every day. I have a lot of friends that use Instagram, and I always see them scrolling through Instagram. I feel like I am the exact same way when it comes to COVID stats and vaccine stats. I am looking at COVID stats every single day, comparing them to where we were at, and looking at that steep decline in daily COVID cases and the increase in vaccine distribution has just been a wonderful daily good news. From NPR this morning, actually, since one of their news articles is, since the US began vaccinations on December 14th, at this point, more than 92 million doses have been administered, reaching 18.1% of the US population. And we are currently administering 2.1 million shots a day, which is incredible. I think we are going at a pace that is more optimistic than what we thought 1 month ago, substantially more optimistic than we thought 2-3 months ago. And I'm sure everyone that is on this call either knows someone who has had their first dose or their second dose of the shot, or have been vaccinated themselves. So the trends are just looking so incredibly positive. And though the US is really doing well with vaccines, we're seeing decreases of cases of COVID globally, and we are seeing more doses of the vaccine being administered globally. So it is incredibly uplifting news for us. So one of the good things about having these, the US really pushing to get vaccines distributed to the general population, is that it could be very likely that other countries that have had their doors closed to American tourism are more willing to open them if you are able to, for example, show that you have had that that you have been vaccinated previously. For many different countries, you need to and still need to have that negative test, but it's looking more and more like the direction will also be moving towards being vaccinated to be able to travel. We also think that there's going to be a lot of demand to travel. We've been in our houses for almost a year, and people want to see their family, they want to see their grandkids, they want to go on a trip. And I'm sure that when everybody's talking with their friends or their family on their Zoom calls or Skype calls, that's the question. What are you going to be doing, and where are you going to go?
Yeah, I think another big question that people are having is, we're trending up, but there is still a lot of uncertainty in the air. Why should people stay on their trip? Why book with Nat Hab now, or why continue with an itinerary you're already booked on if we're still trying to figure all this out?
It's a great question, and honestly, it touches on our timeline for communication. Everyone, we are seeing so much change so rapidly, and we also are seeing that there are areas that really want to be able to open up to tourism, and we again want to be able to support those individuals in those places that we visit. It is so incredibly important to the various communities, and it is so important to conservation as a whole. So the protocols that we have in place are incredibly solid, and we will not operate if we know, or if we do not think that we can really reduce that risk of contracting COVID, again, to our guests, to our field staff, to the communities that we visit. So if we have concerns, we're going to take the time, we're going to think through it and say, you know what, I don't think we can operate, even if this country is open to us. And we'll make sure that we communicate that to you by 60 days. However, with our combination intervention approach, we think we're going to be able to operate in the majority of these locations. So what we're waiting on is we're waiting for them to open up and to allow us in. We've got areas like Alaska, for example, that is incredibly focused on getting their operations their state up and running. They've got, I think, over 20% of Alaskans are vaccinated at this point. So they are one area that is incredibly focused on getting tourism back, because it is such an integral part of their economy.
And other than Alaska, we do have some other places that we're looking forward to traveling to this year. What before we open the floor to questions here, Renata, what's some of the maybe a couple of other places that we're looking forward to?
Yeah, absolutely. So I think it's important just to talk about what we're excited about. We're all excited about getting out of our house and being outside, being back in nature. Many of us who are in cities have not been able to get out and really go on many walks over the course of the past year. I'm incredibly fortunate to be based in Colorado, so it is quite easy for me to get out and go for a walk, but I haven't left the state since I came back from that trip in Spain. So it has, we're ready to get out there. The photo you just showed was of our Grizzlies trip in Alaska that happens this summer. We are incredibly excited to get back to Alaska. And this is from Africa. We've been running trips in East Africa, and we'll be doing South Africa soon. But tourism is just so incredibly integral to the lives of the individuals that live in these countries. And again, from the nature of how we run these trips, they're all open air camps, open air vehicles. So it's prone to exactly how we want to run our trip. And then another location that I am so excited to get back to is Churchill, where we operate our polar bear programs. We unfortunately, Canada was closed and had to cancel those programs for 2020. I was lucky enough, I oversee our Northern Lights programs. I was lucky enough to be up in Churchill in February of 2020. So I haven't missed a year up there yet, but that program is so near and dear to my heart. It was actually, Corbin, you and I started working at Nat Hab together, and Polar Bears was our first season together. So I'm sure you feel the same way I do about how important that place is to us.
Yeah, I certainly do. And I'm looking forward to getting back there just as soon as we can. So Renata, before we open up to questions, maybe just want to touch on some of the specificity of the questions that we're going to go into. I think we've kind of determined that if you have specific questions about your destination or your trip or your itinerary, that maybe reaching out to your adventure specialist is the best option for those answers.
Yes, we're trying to, with this webinar, I know a lot of people have very specific questions to their, either if they're on a trip, their specific destination, or if you're interested in a trip, specifics on that destination. But the purpose of this webinar was to really, in our protocols, is to create protocols that we can apply to all of our destinations. So I hope that the majority of your questions have been answered through this webinar, and happy to take any other ones that we have.
Okay,
great.
Let's hear it from you, Kendall.
Yeah, thank you so much. You guys did a wonderful job addressing so many of the questions. By far, the most popular question was about vaccinations. So I just want to maybe ask you to reiterate the requirements on testing and vaccinations in terms of Nat Hab's protocols. A lot of people were wondering if they are fully vaccinated, do they still need to provide COVID test results prior to traveling?
Perfect. Those phenomenal questions. So with vaccines at this point, we're currently not mandating it. We do think that the pace of which the vaccines are being given out to Americans, it's going to look a lot different with the percentage of Americans that are vaccinated by the end of April and end of May. And we are revisiting how we want to approach if we will mandate vaccinations on our trip, and we'll be very clear and upfront and give as much leeway to our guests as possible if that becomes the case. For testing, again, we'll start requiring guests to get tested before going on a trip starting in May. And with that, we will happily give you resources for either picking a mail-in test, which is quite simple to do, or resources to go out and get a quick PCR test. And then if there is a test needed to take on trip, in order to either, if you're going to a multi-country destination where you need to test in the middle of the trip, or you need to test to get back to the US, we will make sure to facilitate that for you to really streamline that process.
Okay, great. And could you talk again a little bit about the mask protocols? A lot of people had questions about mask protocols in vehicles, on boats, outside, and also about eating arrangements, and in particular places that are cold, like maybe Churchill.
Of course. So with our protocol, currently, and again, this is as we see more and more people vaccinated, we're always inside a vehicle and not able to social distance. You will need to wear a mask. If it is the case that the location requires you to wear a mask, if the country says it's a national, even outdoor mask mandate, that is the case. Again, with our meals, we prioritize outdoor eating and social distancing. So if you're social distance, if you're outside, you do not need to wear a mask when you are eating. If it is the case that for some reason we're not able to facilitate that, it would be the case that you would keep your mask on unless you are actively eating. And if that's not something that you're comfortable with, we can very easily organize takeout to your room as well. But again, more than likely you will be outside, or will be in a private space that's ventilated and you have the ability to social distance.
Okay, great. And a lot of people are just, they're feeling very comfortable with our protocols while they're on the trip, but they're concerned about travel to and from. Do you have any tips to help them get through that?
Yes, and we actually, so before you depart, as I noted earlier, we send out KN95 masks, we send out hand sanitizer, sanitizing wipes, and we also send out a little form that explains just smart ways to travel and how that can decrease your risk of traveling. So obviously making sure when you're in the airport and on the airplane to keep your mask on. There are a lot of airlines still that are allowing for additional keeping those middle seats open, limiting the amount that you're eating or drinking when you are traveling. So that is what we suggest. And if you have any additional questions to that, we highly recommend speaking with your adventure specialist. But I will also note that for traveling, a lot of countries and airlines still require getting a test prior to. So that's why we, after starting in May, will be requiring testing, and then highly recommend that you test prior to your departure as well.
And some people are just wondering about testing for international trips when people are coming back home. Do you help them arrange the tests, or do you provide those for people on the trips?
So we'll facilitate that whole process. So if you at this point, and things are changing rapidly, but at this point you need to test a negative PCR test to get back into the US. There's language surrounding vaccines as well, but if you need a test to get back to the US, we will facilitate that. So what that means is that we will take the group to get tested at the same time, so that everyone has their test result in hand so that they're ready to go. So it's not that you would have to go off on your own and get your test by yourself. We really want to make that easy for you. You're in a country that you may not have been to before, so it is incredibly important to us that is honestly something you don't even think about. You just know at some point you're going to have to get tested, and we'll take care of it all for you.
Okay. And it looks like a few people are still writing in with questions about if they've been fully vaccinated, do they still need to provide COVID test results prior to the trip? Can you reinforce that again?
So we, at this point, if you have been fully vaccinated, you can still transmit that disease, or transmit COVID, excuse me. So it is, at this point, getting a negative test is important. However, I mean, the CDC just came out with new guidelines for vaccinated individuals, I believe yesterday. So that is something that we are continually looking at, and will be looking at on a weekly basis, pretty much, to understand how the regulations are changing and what our guidance is for individuals that are traveling with us. So because of all that is changing and all of the information that's coming in surrounding vaccines, my guess is that there will be some changes that we will be addressing within the next upcoming months.
Mm-hmm. And how far in advance should people obtain a test?
So when you need a test does slightly depend on where you are going. Some areas in some countries are saying 72 hours, some are saying 96. So it varies depending on the location. It would never be more than 5 days before the start of your trip, and it likely would not be less than 48 hours before the start of your trip. At this point, again, things change. Things do change quite rapidly with COVID, but regardless of whatever those requirements are, we will make sure to communicate them to our guests, and we will also make sure to communicate if there are any changes, so that you know exactly when you need to get tested, what type of test it needs to be. If there are any additional entry requirements or exit requirements, we're going to make sure you have all of that information.
Great. And if someone is deciding to arrive early on their own for an upcoming trip, are there certain protocols they should follow in this case?
We recommend continuing to follow the combination intervention approach. So making sure that you are following respiratory hygiene, hand hygiene, social distancing, and keeping up with enhanced sanitation. So following those protocols are really going to, following those steps are really going to reduce the likelihood of you contracting COVID. If you have additional questions and you are arriving early, and maybe you have activities planned that you have questions about, or just general questions, again, feel free to contact your adventure specialist for assistance on those, and we can give additional guidance.
Okay, great. Well, I just want to, before I call it there on questions, I want to say that there are a couple of people watching who have been on trips with us during COVID, and they commented that it went so well and they were so pleased and felt safe during the whole experience. So I just wanted to commend you on your efforts and tell you what a wonderful job you've done so that our travelers can continue to travel during this time. Okay, it's the top of the hour, and unfortunately, we don't have time to get to all the questions today. And as Corbin and Renata said, if you have specific questions about your trip that you have upcoming or potential plans that you have in the future, do get in touch with us. You can give us a call or send an email at the information you see on the screen, or get in touch with your adventure specialist, and we'll be more than happy to answer any questions you have. Okay, guys, I'm going to turn it back over to you for closing comments, and we'll start with Renata.
Well, thank you everyone for joining. Everyone on this call is likely itching to travel, so we are so excited to get back out there with you. And if you have traveled with us already, thank you so much for joining. I hope it was an absolutely wonderful experience, and we hope to see you traveling with us soon.
Yeah, thanks, Renata. Thanks for inviting me to do this with you. I always enjoy working with you, and thank you for all that are listening. this is really exciting time right now to sort of be on the upward trend of getting back to life as we knew it before the pandemic. So we're really excited to be working again and getting people out there. And as always, Kendall, thanks for facilitating all of this and putting it together. And I hope to see you all out there.
All right, thanks again, guys. And my thanks as well to everyone who tuned in. Be sure to join us tomorrow for our next Daily Dose of Nature. We did record today's presentation, so we'll have the replay available on our website soon. And with that, I'll conclude the webinar. Goodbye, everybody.